From Wish TV and the All Indiana Podcast Network, this is the Business, Equity, and Opportunities Podcast with Scott Sander.
Welcome to the Business, Equity, and Opportunities Podcast. I'm Scott Sander. On this episode,
a healthcare tech company gets access to capital in a big way. We deal with stress in the workplace. We asked some experts how to make sure business is more satisfying than stressful. And next, our industry focus is on the business of golf in Indiana and how it may help your business.
Every business is unique and has a target audience. If you own or manage a business, Circulus Digital Media can help you connect and grow your customer base with turnkey digital solutions that are nimble, offering best-in-class results, service, and support to reach a bigger customer base, allowing you to pinpoint a specific audience down to the smallest details. Get outside the city, the state, span the globe. Put Circulus Digital Media to work for you. Get started now at circulusdigital.com. That's circulusdigital.com.
Welcome back to Business, Equity, and Opportunities. I'm Scott Sander. Time to talk about accessing capital. Healthcare tech company Blue Agilus aims to pioneer a revolution from the boardroom to the bedside. And the company got a big chunk of seed money to fuel the effort.
This is Business, Equity, and Opportunities. Access to capital.
Nadia Adams is the founder and CEO of Blue Agilus Corporation. She tells us how a big investment could lead to a big advancement.
So my company is a healthcare technology company, and what we really focus on is surfacing the clinical solutions to everyday problems that healthcare systems, clinical teams from like primary care practices and specialist practices are facing when they're looking at how do we improve quality, health outcomes, and cost of care, as well as patient experience. So I started this company really with over a decade of experience in trying to solve this problem. Basically, the tools and approaches that we had access to just weren't giving us the outcomes that we wanted to see. And so we really started exploring this field. And I will say that Dr. Bustani is kind of the scientist around it. It's called Agile Implementation, Agile Science. And so our technology is really framed from Agile Transformation, which is using those methodologies and tools to kind of accelerate the work of quality and cost. I'm personally passionate and motivated about this because I don't know if you know the statistics, but 1 in 4 patients that access our healthcare system today receive preventable medical harm, and that doesn't even include preventable medical death. The word preventable means that it is preventable and we can do better. And so that's my whole motivation around this. I have a personal story. My younger brother, when he was born, my mom was going into labor with him. She went to the hospital in the middle of the night, and there was no doctor to deliver him. And so she waited 45 minutes later. Her OB arrived, realized that he needed emergency C-section, and basically it was in the NICU for over a month. So none of the physicians and nurses thought that he was going to make it. They actually asked my parents to find burial grounds, and then the first time he cried was 28 days after he was born when they pulled the umbilical cord, and truly, it was a miracle. That motivates me in really trying to eliminate preventable medical errors and death. And unfortunately, with the pandemic, I think things have probably gotten even more exacerbated just with all of the burnout that our great clinicians have faced. And so the technology takes all of the evidence-based solutions that exist out there. We surface it in a simple way, right, where everyday clinical team members can take it and understand. We make it easy to find, and then we understand how they practice. So one thing that everybody always talks about in healthcare is local, and it is truly local. But no one has figured out how to take standards and localize those standards. And that's what our technology actually does, is we know that every practice is different. We know that every community is different. We know that the patients within those communities are different. And so we take in information and try to understand how do those providers like to practice? What is their practice operations and workflows? Who are these patients? What do they have access to in their community? And then we're able to auto-generate very customized interventions or blueprints that meet the clinical needs that they're trying to address. I tell people every day I feel very grateful and blessed and appreciative as a entrepreneur that's only been doing this for 2 years. Is we got $2.5 million in seed funding, but we are EBITDA positive right now after being a 2-year-old company. And so that truly gives us kind of an advantage where we can take the $2.5 million and truly invest it into product development. So we use AI, but we want to continue to invest more into AI and machine learning, because the more that we do that, the more precise that we can get around auto-generating these blueprints for these clinical teams. Another thing is, we are able to scale and expand. So 80% of the clients that have worked with us in the past 2 years have wanted to scale after 6 weeks of implementation. And so that's really where we want to take the money that we've received, is to really create greater impact across the nation with the technology that we've created. You need to know what I call is your minimal viable goal. What is it that you're not willing to negotiate on, right? So for me, that is, I'm going to work as hard as I can to make sure that health outcomes are improved for all, right? But you need to be very flexible on the path to get there. So if you come up with the idea and a plan and you think that that's the way to get to your goal, and then you start trying it 1 month out and it doesn't work, you need to be willing to flip-flop. You need to be agile, right? You need to actually change. And even with me and getting the seed funding, I probably did 50 pitches in a month and a half. And I learned so much, right? And I think that's the biggest thing that I would tell entrepreneurs is it is evolving. Do not fall in love with the process, but stay committed to your mission and don't waver from that mission, but be willing to flip-flop in how you get there.
Running your business day to day can be satisfying, profitable, even fun, but it certainly can come with stresses too for you and your employees. We asked some experts how to make sure business is more satisfying than stressful.
This is Business, Equity, and Opportunities. Running your business day to day.
Kimball Richardson is the Manager of Business Development for Community Behavioral Health and the Fairbanks Recovery Center.
We can't avoid stress. And I'll tell you something else. Stress is not inherently bad. There are some parts about stress that are actually good and motivating. They help people to work at their, I like to call it, peak performance. It's when it's either too much or unrelenting that we find ourselves tipping over that edge, and then it becomes stressful. I really appreciated when business owners can not only have intelligence about their business and products, but what we call emotional intelligence, which means let's keep in mind health of your employees also has a financial aspect to it. So, and health can mean physical health, mental health, and spiritual health. And if you're okay with that full concept, usually that's what helps buoy your employees throughout the year. It's tough to have that balance, especially if you're in a small business where you have many hats. And it's so important to take extra time out, even if you, I know this sounds a little odd, but even if you have to schedule it. You know, it's on our watches, it's on our phones. Stand up, breathe. And it can be a little annoying at first, but it is a reminder that this is a long-term effort, and this is keeping you healthy, not just now, but for the long run as well. It's so important for business owners to think about their employees, and while we appreciate that, we want them to think about themselves too. And we know that usually people who are in smaller sized businesses are very driven, but sometimes don't take that extra step to care for themselves in their emotional health. So please think about that and be cognizant of that, because we want you around for your family, friends, and business for the long haul. There's a lot of places organizations, agencies, or even individuals that can offer mental health and substance use disorder help to literally any size business, but especially our entrepreneurs and small businesses who may not be able to offer healthcare insurance. So if you talk to your family doctor, if you call a crisis line that could be 988, or it could be a local crisis line such as Community Fairbanks Behavioral Health, and ask, I have this going on, I'm not sure what my resources are for assistance, we can help with that. Stigma around mental health help is still here, even in 2023. It's getting better, even in my 37 years of being in this profession, it is getting better, but there is still some there. So I think just rethinking it, that it's actually brave to ask for help. What's the harder thing to do for most people? To keep everything inside and shut up, or get help? It's to get help. It's seemingly harder to do. In the long run, it'll benefit your health, and it might even save your life.
Welcome again to Business Equity and Opportunities. Time for our industry focus, this time on golf. Since the start of the pandemic, the business of golf has been booming, and that could be important to you because it means business on the course may boom too. It's well known that relationships grow and deals get done on the links. A recent study examined the economic impact of the game in Indiana.
This is Business, Equity, and Opportunities. Industry Focus.
Mike David is the executive director of Indiana Golf. We met him at Broadmoor Country Club to learn more about the sport's impact on the state.
Well, my name is Mike David. I've been with the Indiana Golf office for 33 years now, and basically Indiana Golf is the administrative offices for 5 different golf-related not-for-profits. So our vision statement's to be the vital hub for golf in Indiana, and we try to be one-stop shopping for everything golf, basically. Yeah, I think the biggest number that came from our economic impact study was the fact that golf is over a $2 billion industry for the state of Indiana, which is certainly significant. And for those of us that work in golf, I think we realize it's big business, but when you see those numbers on paper, then it really resonates. It's 23,000 jobs related to the game of golf in the state of Indiana, over $600 million in wages. So it's a significant part of the Indiana economy for sure. So, we have 400 golf facilities around the state, and those golf facilities are using local businesses for their suppliers for, food and beverage, for grass seed, you name it. There's a lot of connection to the local businesses there. But the other significant part, I think, and this study showed that, is that the game of golf means about $50 million to charitable organizations around the state. 80% of our facilities are hosting a charity event every year. So I think that really shows the game is giving back to the community and really making an impact on some of those local organizations that are hosting events at our golf facilities. Well, not only the camaraderie from the game, but just the networking opportunities with the game of golf. At a lot of these charity outings, you're put with people that, you may know, but you're having an opportunity to network with them, to get to know them better. And then, you can learn a lot about people in 4 or 4.5 hours on a golf course. So it's a significant opportunity. It provides a significant opportunity, I think, for that networking and for just people to get to know each other and really conduct a lot of business on the golf course as well, which that's definitely happening. I think the future for the game in the state looks really bright. I think what this study showed us is golf is very healthy right now. You hate to say it, but obviously the pandemic pushed a lot of people to this game. And I think it brought a lot of new people to the game, but it also brought a lot of people back to the game. And I think what they found is, it's a healthy opportunity. It's great exercise. You're outside. There are a lot worse things to be doing. So I think that we'll continue to see the trend that we've seen really by the pandemic pushing people to the game. I think that'll continue. And I think what also will help the game moving forward, really 2 things. A lot of the workforce is still remote. And I joke around that it's a lot easier to sneak out of your house than it is your office, but that's a fact. A lot of people are scheduling their day around getting out to play 9 or 18 holes, and I think that will continue to a degree moving forward. But I think the other thing that makes the future bright for the game are our junior golf programs. Indiana's always been very supportive of junior golf initiatives. Part of our organization is also the First Tee Indiana. So we have 100,000 kids throughout the state of Indiana who are part of First Tee programs. We're in 325 elementary schools with the First Tee's National School Program. So I think when you look at, the accessibility of the game, and the junior programs we have, why you can't help but feel good about the future. We've got a significant number of our courses that are open to the public, and then when you look at because I think the stigma with golf is it's expensive and it takes a long time, and I think we kind of see that that's maybe not the case here as much as it is in maybe Chicago or Los Angeles or Phoenix or someplace like that. We have 5 different organizations that we administer, and literally one minute it could be something related to the Indiana PGA, the next it could be something related to the Indiana Golf Foundation. So I think the variety keeps me excited about what I do. But really, the most rewarding thing that we're involved with is what I've already mentioned. That's our junior golf side of things. To provide the opportunity for kids to learn the game they can play forever. I mean, my dad played till he was 90, so it truly is a game of a lifetime. And with First Tee, we're really introducing the game to kids who may not otherwise have an opportunity to be shown the game of golf. And then we need to make sure they have an opportunity to get on the golf course, they have equipment, et cetera, and we're doing that. But I definitely think the junior side of things is probably the most rewarding because we're really seeing it have an impact on these kids' lives.
Our thanks again to all the contributors who joined us for this episode of the Business Equity and Opportunities podcast. We hope you found it enlightening, useful, and inspiring. You'll find more information about the show on our website, BEOshow.com. You can watch Business Equity and Opportunities Sunday mornings at 10 on Wish TV or live stream it through wishtv.com. Each week we provide 7 full segments with topics ranging from how to get started and how to access capital to the day-to-day running of your business and questions about accounting and bookkeeping. We feature business news and trends and always share a success story from one of our contributors. Join us next time for more insights into the world of small business. Be sure to sign up for our Business Equity and Opportunities newsletter to get even more valuable, up-to-date information. And if you have any questions or you'd like to be part of our show, please email us. The address is beo@wishtv.com. We'd love to hear from you. I'm Scott Sander. Thanks for listening.
Watch the Business Equity and Opportunity Show on Wish TV and access all of our content and share it on demand anytime at BEOshow.com. You can find more podcasts from Wish TV on the All Indiana Podcast Network at allindianapodcastnetwork.com.